That new directive issued in the health sector seemed to imply that in order to get English service in the healthcare network, oral and written communication with the health ministry, you would have to get your English admissibility certificate for education and make a request to be served in English. He says it is not the case for healthcare delivery. He says our priority is to care for people regardless of their language. And the directives say that an organization may deviate from the obligation to use French exclusively when health, public safety, or natural justice principles demand it. For a reaction, we have on the line Eric Maldoff. He's a Montreal lawyer and the chair of the Coalition for Quality Health and Social Services. Eric, are you reassured?
Frankly, the fact that we're even having this discussion is what should make everybody nervous. Effective communication is of the essence to the delivery of safe and effective health and social services. I can't believe that anybody would imagine that health and social services can be delivered effectively and safely without there being effective and safe communication if the doctor doesn't understand the symptoms, if the patient doesn't understand the diagnosis, and I can go down the list of where everything, communication is essential throughout the process of delivering health and social services, whether it be with pharmacists or whatever. People have to understand what's happening, and if not, there is tons of data and studies that show that it has adverse consequences on health and safety and good outcomes of healthcare. Now we're having a discussion of, do we read the law right or wrong? The fact of the matter is the law says exclusive use of French. It says if there is an exception, the provider of the service is entitled, may, not must, speak to the person or communicate with the person in another language. But then it goes on, every time it says something like that, it says, but they have to be, they should not do it systematically, and that they should do whatever they can to avoid using the other language. Now, it's true that later on in the law and in the directive it says that what was being called historic Anglos, now they're called recognized English-speaking Quebecers, would be able to be served, or someone would be able to serve recognized English speaker in the English language. The word is may, not must. So with the exceptions which speak to historic Anglos, in that case they're saying that what they're defining that as meaning is that that person has, or apparently would have, an eligibility certificate for access to health and to education in the English language. Well, the problem with that is eligibility certificates are issued to the children, not to the parents. So for adults who have graduated or finished high school, if they don't have a certificate, then they're not getting one. And furthermore, the Office de la langue québécoise de la langue française has made it clear, and there's a dispute. It's before the courts right now. They've cut off giving eligibility certificates if you have already finished high school. So that leaves a whole chunk of the population where that would not automatically apply. Now, the regulation and the law say if it's urgent, if it's absolutely clear that they can't understand, then they may use another language. So the confusion persists. They may or they may not. Plus, the Bill 96, or the language charter as amended, says that people working in the public sector, as a matter of fact, everybody, has the right to work in French. And you're seeing now complaints at the office about this kind of stuff. The issue will be that what if the person that you encounter says, I have the right to work in French, and that's what I'm doing. There's no obligation to do otherwise, and they can count on this right, which is this government Bill 101, the Charter of the French Language, is described as the fundamental law of the land. It takes priority over the secularism law, and it takes priority over the charters of rights, federal and provincial.
That really boggles my mind, because the implication is that a healthcare worker who has a bee in the bonnet about wanting to speak only French at work can say to an Anglo lying bleeding on a stretcher, my right to work in French trumps your right to live. Your right to be preserved from death, that's nothing compared to my right to work in French. It is mind-boggling that there could be an interpretation of the law that way.
Well, it's hard to believe that anybody be that heartless and dangerous in working in the health and social service sector. So I don't want to ascribe that to, in my experience with all my French-speaking friends in the provinces. This is a pretty generous and welcoming population. It's just we've got a law adopted by a government that doesn't have quite the same spirit. But yes, what you say is absolutely right. We have a charter right to security of the person. If a law puts you in a position where your physical security is endangered, then you would be able to invoke your charter right to security of the person. That right in the Charter of Rights and Freedoms, Quebec and federal, has been overridden by the Charter of the French Language. Consequently, it is true that you would be unable to invoke your right to security as taking priority over the Charter of the French Language. And that's what the government's written into its law, which, by the way, the federal government has sort of benignly or passively approved with its own amendment to the Federal Official Languages Act. But that's what we've got to. And the point is, we shouldn't be having debates about language in the health and social service sector. I think about it. If the Ministry of Finance decided we really have to get a grip on finances, so we're going to create an Office des Finances, and that's going to go into every public institution in Quebec, including hospitals, and they are going to challenge doctors and nurses as to the use of various procedures, of the use of various implements. Was that necessary? Can you justify it? I mean, this would be crazy. No one would think that a doctor should have to justify using a stethoscope or ordering a CAT scan. That's a professional judgment. Well, to say that somebody's going to tell a doctor, a nurse, an orderly how they deal with a patient, or have those people having to think twice about what they do because they may get reported, they may get turned in, they may be investigated by the Office québécois de la langue française. The head of the institution is under instructions under the Charter of the French Language to enforce the Charter of the French Language. So the employee who decides that I'm going to serve somebody in English because I think it's fine, or in Greek or whatever, somebody overhears that, makes a complaint, the head of the institution's called on the carpet, why aren't you enforcing the law? And the sanction for the employee can be an employment-related sanction affecting their employment. Has
the Coalition for Quality Health and Social Services been seeking a meeting with the Health Ministry to discuss this, or the French language minister, Jean-François Roberge, or anyone else in the CAQ government?
This has all been raised long ago. I mean, the directive is drawing attention again to what was evident from Bill 96, that massive reform of the Charter of the French Language. Those discussions, well, the government was not very willing to enter into discussions. These issues were raised, they were submitted, and there was no real ability to have a meeting with anybody to discuss this or any of the implications. Their attitude was, this is what we're doing. To the point that when people were raising these issues, Premier Levesque bought an ad campaign in English newspapers across the country saying English health and social services are not affected by this amendment to the language legislation, which is false.
This is exactly what Jean-François Robert said on X today. He tweeted, why are you worried? Eric Maldoff, thank you very much for your time. I appreciate the interview. Eric Maldoff is a Montreal lawyer and chair of the Coalition for Quality Health and Social Services.